Um, Hello all. In this video, we'll learn about colored halos. So what are colored halos? And most of you, whenever you tell the symptom of gradually progressive loss of vision, you'll give a negative history of colored halos. And there's a short question of, so what is colored halos? What are the causes? How do you differentiate? So in this video, we'll learn about that. So what are colored halos? The patient describes it as seeing rings of rainbow color around a light. Okay, so most often it is blue on the inner side and red on the outer. So whenever he sees a light, he sees that there is a ring of rainbow color around the light. This is what a patient describes it as: blue innermost and red outermost. Now it is only you see in an incandescent light only and not around tube light, because incandescent light has all the colors of the white light and tube light will have only one particular wavelength. So why does the patient see colored halos or rainbow color? So you need to know that why do we see rainbow? Whenever light passes through droplets of water, it is dispersed, it is broken into its component colors. So whenever light passes through the eye, and if it encounters water droplets, it will be broken into its component colors and the patient sees colored halos. So this is because of prismatic effect of the fluid that is accumulated in the path of the light. So if there is fluid in front of the cornea, like in conjunctivitis, or fluid within the cornea, or fluid in the lens, then we see colored halos. So three common causes are acute mucopurulent conjunctivitis, acute angle closure glaucoma resulting in corneal edema, or corneal edema because of any other cause, like in case of Fuchs endothelial dystrophy, okay, or corneal edema because post-op corneal edema. These patients can also see colored halos, or in the lamellar separation stage of senile cortical cataract. Only in this stage or incipient stage, not in mature stage, not in hypermature stage. Only the lamellar separation, because there will be fluid vacuoles and in the within the lens, and these can cause a disperse the light. So if it is colored halos because of acute mucopurulent conjunctivitis. Colored halos are due to dispersion of light caused by the mucus accumulated in the conjunctival cul-de-sac. So this mucus which is accumulated in the conjunctival cul-de-sac will cause dispersion of light if it is in the path of the light. So how will you identify it? Obviously, the patient will have conjunctivitis. He'll have mucus. You will say that he has a discharge, stickiness of eyelashes and everything. And if you do an eye wash, if you clear up the mucus, the colored halos disappear. Okay, this is how you identify colored halos because of acute mucopurulent conjunctivitis. Patient will have symptoms of red eye, mucopurulent discharge, and you give a eye wash, and the colored halos disappear. Now, colored halos because of corneal edema. If you see there is fluid accumulated within the cornea, there are fluid vacuoles within the cornea, and this is because of acute angle closure glaucoma. So whenever this fluid vacuoles accumulated within the cornea, light enters and gets dispersed. It causes a diffraction of light. It acts like a prism. So in case of lamellar separation of cortical cataract, so there is fluid accumulated within the lens. So light passes through it and gets diffracted here, okay, in the lens level. The diffraction in case of corneal edema is happening at the corneal level. Colored halos are happening of dispersion of light due to fluid vacuoles accumulated in between the lamellae in case of lamellar separation of cortical cataract. So how to differentiate between colored halos from cataract or corneal edema? Okay, whether it's colored halos are because of cataract or because of corneal edema. Now we do something called as Fincham test. So here a stenopic slit is passed in front of the pupil from one end to the other, and we ask the patient if he sees any broken rings. Okay, so a stenopic slit is passed across the pupil of the patient from right to left. Okay. And if the patient sees broken rings, so as you pass the synovic slit across the patient, he says the rings, what he's seeing, colored halos, are being broken. It is at this level he sees it like this. As you pass it, he sees it broken rings, and as it passes along the in the center, only certain rays are being stimulated, so he sees a broken ring. So if he sees broken rings, then it's probably because of senile cataract. This is because of the arrangement of the lenticular fibers. Okay, the lenticular fibers are arranged radially and they have an onion ring appearance. So that's why when a synovic slit is passed and if it is causing diffraction colored halos, the patient sees it as broken rings. But if he doesn't see any broken rings, the colored halos remain the same as the synovic slit is passed across the pupil, then the colored halos are because of corneal edema. So in summary, colored halos, they are rainbow like rings of rainbow color seen around the light, and causes are acute mucopurulent conjunctivitis, senile immature cataract, or corneal edema. How do you differentiate? Acute mucopurulent conjunctivitis symptoms are of red eye, mucopurulent discharge, and if you give a eye wash, the colored halos disappear. In case of senile immature cataract and corneal edema, there's no mucoid discharge. Okay, but if you do a Fincham test or pass a stenopic slit, it gets broken in case of senile immature cataract, and in corneal edema, you don't see any such change. Thank you very much.